torn between general surgery and EM. I'm worried if I choose EM, I'll always wish I was in the OR operating. And if I choose surgery, I'll lose the other parts of me that make me who I am. Music. Try to use your 80-year-old self to make your decisions. When you old as hell, on your gravestone, what's the story that you want people to say about you? When you're 80, are you going to be regretful that you didn't go for what you really, really wanted to do? Which it sounds to me, it sounds like you want to be a dope doc and you also want to be an amazing musician.
A hip-hop artist.
Do you want to be the Drake
or
hybrid?
Do you want to be Kendrick?
Being a doctor is no joke. It takes a lot of dedication, a lot of sacrifice. You're going to feel like you're on an island a lot of times. So I would say is like, listen, like shoot for the stars. If you really love surgery, now is not the time to compromise. What's good, everybody? Welcome to another episode of Docs Outside the Box. This is what y'all say. We're super psyched about everybody who writes to us. There's so many different ways that you can reach out to us. Instagram, Twitter. Actually, not Twitter. Instagram, email. There's text. Hey, listen, there's a lot, man.
Just go in the show notes. You'll find all the things.
Yeah, you'll find it all there. And we just want to say thank you very much. And today, before we jump into today's question, which is a really super deep question about what specialty to go into, specifically if you have a passion for it, let's jump into real quick about our previous episode where we talked about LLC versus S Corp and all that stuff. So, guys, we recorded an episode where we were talking about the different entities, the different tax entities for your business. There's LLC, there's sole proprietorship. Then there is, well, how do you want to get taxed by the IRS? There's S Corporation and C Corporation. And in that episode, I thought I was whooping some ass and I thought I was being super clear as possible. But there's always that one person who writes in and has to share their information about certain things. So we got a message here to soup your head up even some more. Let me see if I can share this page. Let me see. Boom.
You got to put somebody on blast like that, Nee.
No.
Boom. No.
So he says, Darkwa says, Renee definitely won the LLC versus S Corp argument. She's 2-0. I don't know where the other one came from.
I mean, he probably listened to another episode where I knocked you down there. Also, go Alfred.
You're letting me down, Nee. So,
yeah.
Darkwa, my cousin, my chale, listen, that was great.
Why you gotta put him on blast like that, yo?
That's great that you did that. How do I stop my screen? That's great. I listen. I guess I wasn't being very clear, but guys, this is on purpose. This is just to say, listen, even if I'm not perfect with my answer, it doesn't matter. I'm moving forward with being an S Corp, moving forward with being an LLC, right? Because guys, listen, as doctors, we need to know from A to Z before we go ahead and take that test or board exam and so forth. And it's for the test of life and the test for business, you ain't got to know all the answers. You just got to know that you're moving in the right direction. And I think for 95% of the people that I was telling the information for, I think I was correct.
He didn't say you were wrong.
No, he said that you got me.
Yeah, because you were explaining something, you were saying something, and there wasn't the background context for someone who didn't know at all what you were talking about.
No, I think you were just being nitpicky, and you were just kind of let me find small little things to just go at it. And this person,
right again,
say that.
Tell me if I'm 3 for 0.
But listen, guys, go check out that episode because it's a really good discussion primer on what exactly is a business entity, right? Like, how do you create a business or why you create a business? And then how does that business get taxed? How do you figure out all those different ways? It's a short episode. We did it while we were literally having an amazing vacation while the kids were gone. But it is a true to form discussion, right? About what we do with our business entities. Not all of them, right? Because our real estate entities are not S Corps.
Correct.
Our real estate entities are just LLCs, and we just make it work that way. The podcast business is just an LLC and we make it work like that. But Don Quan, we appreciate what you wrote. That was amazing. I appreciate that. On purpose, I let Renee win these things because I think
you don't have a choice.
I think it's better when I'm the bad guy on the show. Everybody appears to want to make me the bad guy, so it's all good. And on that note, On that note, I got to give a quick shout out to my wife, Dr. Renee. She had a birthday.
Yay.
This past weekend. I'm not sure when this episode is going out, but just know whenever I recorded this past weekend, we celebrated your birthday. I'm not going to say what age you are. Just know that we can make more contributions to your IRA because of that. Yeah, girl. Doing your job. So you guys figure it out from there. But my baby, my wife, my partner, my co-host, almost ex-co-host, she turned a certain age, and I have seen you grow from the age of 27 to where you are right now. And I got to say right now, I'm super proud of where you are right now as a mom, as a sister, as a wife, as a podcast host, as a daughter. You've grown in so many different ways. You were amazing when I met you then, but you're even so like amazing right now. And the things that you're able to accomplish is just amazing. The way in which you take care of our kids, the way in which you take care of me, the way in which you take care of this podcast, among other things. And, obviously being a great sister to, your brothers and your sisters, I think it's amazing. And being a great role model to the kids as well as to your nephews and nieces. Super dope. Super dope. This is a huge milestone for you. And listen, let's make it happen over the next, several decades. Because we don't have many more left, right? You don't have many turns around the sun left, so let's maximize it, right? Remember who wins.
You plan on killing me?
Remember who wins these arguments, right?
Y'all heard it here
don't
first.
Don't focus too much on arguments when you could be, focus on living life and stuff, right?
So thank you very much. I had a great birthday.
Not only do I lose arguments, I'm like the worst. Like I have to give the worst speeches. I do give the worst speeches. Let me tell you guys real quick what I'm really bad at. Not to cut you off.
Yes, you cut me off.
I'm really bad at, but that's the way it works, though. I'm really bad at speeches. I'm really bad at line picking. Ask her.
Lane picking.
Lane picking, whether it's...
That's why you're bad at speeches, because you don't speak. It's lane picking, not line picking.
Even at TSA, whether it's TSA lanes or lines, if it's on traffic trying to get to New York and, you trying to choose which traffic, which lane is moving faster than the other, just know whatever one I'm going to pick, you're going to end up lasting because it makes no sense. I'm horrible at it. But no, go ahead and say your stuff about
I was going to say thank you. Thank you for an amazing birthday. So I am officially over the hill. And
right in time.
So my husband and my sister threw me my husband and my sister threw me an amazing party. We had a get together at my sister's house. And with decorations, food. The food was amazing.
What kind of food did you have?
Ooh, we had that Haitian food. We had that duya jonjon, duya pois. We had tasso. Oh my God, the tasso was so good.
What is tasso? Tell them what tasso is.
Tasso is goat meat. It's one of my favorite meats. It's my second favorite meat after oxtail.
Yeah, tasso is good, but goat meat in general is just...
It's just so good.
There's too much work you got to do. Man.
Oh my God, it's so good. Will you ever see a baby goat and you just be like, he looks so tasty. I can't look at a goat without thinking how tasty it looks. I'm sorry. Sorry for all you vegans and vegetarians out there, but a goat, they look tasty.
Well, I think for the majority of people outside the United States... I think that's how they look at goat. They'll see a baby goat, be like, I can't wait for you to grow in 4 or 5 years. Oh, I can't wait. I can't wait for you to go to high school.
A lamb too. Ooh, lamb chops, good. But anyway, one of my brothers, bought me a tres leches cake, which I absolutely love. Tres leches cake.
It's very good.
Very, very good. Yeah, just had a great time.
So you're not even going, hold on a second.
Wait. And then my uncle and his wife got me this, which, let me tell you something. When I opened this gift, I was so excited. I've never been excited about a gift like this in the last, maybe 5 years.
Why is there a compass on this?
Just in case I get lost while I'm drinking. Depends on what's in it. You could get lost if you're drinking that much. Okay. It's so great. So it's this water bottle, and it's called RBX. And it's just amazing. It's a great water bottle. It can hold
They're not
cold. It can hold heat. So shout out to my Uncle Leslie and his wife Nadej for giving this to me.
One thing that I realized that you didn't mention was the Costco cake that I got you. But that's okay, though.
Well,
I guess it wasn't memorable.
So.
Listen, I'm just going to say this. No, before you even listen, guys, if you're ever looking for a cake, I'm telling you right now, Costco has really dope cake.
I love Costco, and check out the size of their $1.50 wiener.
But I do feel like I feel a type of way, right? Like I got a cake. Anybody who knows, if you get a cake from Costco, like it's pretty basic, but the cake tastes amazing, right? Like
Yes.
they'll put like candles and like, what else would they put?
Decorations.
They'll put decoration. They'll put like a cross on it. They'll put a rainbow on it. They'll put balloons on it and stuff like that. But then like your brother straight up went, and your sister straight up went to a place that can put your damn picture, a real life picture on your cake. And I'm like, yo, don't you guys think you need to clear that by me first?
Yeah,
Because
you need to show my brother's cake. You need to show my brother's
I'm like,
cake.
yo, I got the cake. I told them I got the cake. But then they're like, nah, we got this. And they went ahead and like upped the ante and got a better cake that had your picture on it. And I'm like, okay, that's messed up.
Yeah.
That's really messed up.
Well, I will say my Costco cake was amazing as well. It tasted
But you didn't.
so
But you didn't
good
mention
and
it though.
So chocolate. But you didn't let me finish.
No, but you like went straight to like the damn water bottle.
Well,
with
because I
compass on it.
remembered it and I didn't want to forget. But the chocolate cake was good. So I'm the kind of person, for those of you who might be like, why you went to Costco to get your wife a cake, especially for a milestone birthday? So
First of
that
all,
was my.
I don't care about those people who say that.
I
They need
didn't
to
say
mind
that
their
they care.
business.
I said
Costco has the best return policy.
Oh my God! I'm
you can
saying
you can
if
return the
they're
cake. I
wondering,
think.
You know what? You can't return no cake to Costco. What you gonna do? Cut into the cake, eat it, and then return it? How, Nee? Anyway, listen. So I requested a Costco cake because I am the kind of person, I actually don't like those fancy, schmancy.
You like a cake that tastes good.
I like a
Simple.
cake that tastes
A
good,
simple
not
cake
just
that
look
tastes good.
good. I mean, the cake look good, that's great. But
No,
at
no,
the end
no.
of the day,
The
the cake gotta gotta taste good.
Guys, the cake that
Well, that was a cake that looked good and
the
tasted
cake
good.
that Holly bought.
mean-
Woo, Tres Leches. But I'm just saying he still should have cleared it by
What
me.
Trace Leches?
But hey, from Newark, New Jersey. But listen, that's
You
a great.
insulted Alfred.
Hello, my name is Alfred. You said Trace Leches. Prepare to die.
That's a great cake.
Alfred, tell him how to say Trace Leches.
Tres leches, tres leches, tres leches.
Is that Spanish? Isn't that French?
Tres Leches cake is Mexican cake. What are you talking about?
Isn't that flan?
Flan is Puerto Rican. It's not no flan. It's
Alfred,
flan.
write in and let us know what you think. Actually, you don't like put the message. All right. Anyway, tell them about the Costco cake. Tell them how good my cake was.
It was really good. It was very
did you taste
chocolatey. Of course I tasted it. It was good. It was very chocolatey. Actually, your cake
I know it.
went really, really fast.
Always does.
And there was literally only like a little slice of tres leches left anyway.
Yep.
So yeah, but it was really good. I mean, the whole event was good. The whole weekend was great. I love, if anybody knows me, I love being around my family. Absolutely love. You can take anything else away from me, but just don't take my family away from me. I love being around my family. Love, love, love. Whether it's my side, your side, I just love being around my family. Then we went to your sister's house on Sunday. Spent a little bit of time. We probably could have spent a little bit more. But yeah, I just love being around my family.
Yeah. So shout out to you. Listen,
In
everybody, just so y'all know too, like don't think that like we don't think about just life in general and how things go so fast. Like, yes, I met this woman 27 years ago.
You didn't meet me no 27 years ago.
Oh, sorry. I met you when you were 27. Excuse me. Met you when you were 27.
Add on years.
Haven't met you yet for your entire, like for half of your life yet, right? Not there yet. But what's really interesting is we started this whole journey of paying off debt, listening to podcasts over 10 years ago.
Yeah.
And it's crazy how a lot of things have changed.
Mm-hmm.
And we have an episode that's coming up where we're going to talk about, having, like when you listen to social influencers and you listen to people who are on, just various forms of social media, like if you kind of are not really, if you're not really smart with the decisions that you're making and what you decide to take in and take action on, like you're going to find yourself doing so many different things. And we're going to talk about how we have so many things on our stove, you know, so to
many
speak.
irons on the stove.
It could be overwhelming at times. So we got to check out that episode. So listen, let's get back to what someone wrote for us, because this is going to be, or wrote to us, this is going to be a really interesting concept. So let's jump into that. You ready?
Okay.
All right. So we got a question. So you do not want me to share this page anymore, right?
No.
Give it to Alfred.
Give it to Alfred.
All right. So this is from an anonymous medical student, 856. Hey, Dr. Nee. First off, I love your podcast. Just found it today. And I love the topics you are discussing, especially as it relates to finding purpose and whether that happens only in your career or outside of it as well. I'm currently an MS3, about to apply for away rotations. Apps are due in a few weeks, and I'm torn between general surgery and EM. What a shocker. I'm sure you've never heard that one before.
Sarcasm.
Initially, I decided to just default to EM because I like acuity, shift work, and I have a musical career that I was hoping to keep somewhat alive through residency, even if just barely, and return to after training. After finishing all my rotations, it's become clear to me that surgery is where I enjoy myself the most in the hospital. I practice not for fun. I enjoy the technical aspects of operating, learning steps to procedures, and taking care of surgical patients. I enjoy the structured flow of the day-to-day of surgery residency, rounding, cases, consults, rounds. I still enjoy EM somewhat, but I realize the chaos makes it very hard for me to feel like I am focused on one patient at a time. Surgery is one of the few specialties where you can spend hours on one patient. As a trauma surgeon that has incorporated locums into his career, I feel like you are the best person to ask this question. Is it very rare to have a setup as an attending general or a trauma surgeon where you work 7 on, 7 off, or 7 on, 14 off? Is it possible to keep a 30-minute per day habit alive during 80-hour weeks of surgical training? Or should I let go of my love of surgery so I can keep balance in my life? I'm worried if I choose EM, I'll always wish I was in the OR operating. And if I choose surgery, I'll lose the other parts of me that make me who I am, music. I'm terrified that I'm either about to make the worst or the best decision of my life. Warm regards, a very confused MS3. Kick Renee off the show. You know exactly what you talk, and you can do this solo dolo. Anonymous med student. Damn,
Okay, that part didn't. The last part you can erase, Alfred. That because never. That was not said.
Anonymous med student, this was a great question. First of all, I appreciate you being vulnerable with this. A lot of people think about these things, but you know, I was doing an episode, or I did a recording with Peter Kim because he's talking with his summit that he normally does. And I was saying that he asked me, like, how do you feel almost being close to 10 years being in this space? And I said, one of the proudest things that I look back on and I smile about is knowing that I was part of the, you know, like the fabric. I was part of that quilt that made it easier for medical students to submit a question like that, right? Because I think 10 years ago, 15 years ago, nobody was out there really in public talking about how like they want to be more than just a doc. People were complaining about their lifestyle and complaining about certain things, but they necessarily weren't creating content that showcased that, hey, I'm a med student or I'm a doc and I'm just interested in doing different things with my life that's not clinically focused. So I feel really souped about being part of that storytelling. So anonymous med student, thank you for writing that in, because I know it's hard to share those things.
Yeah. Actually, one of your very first posts, if not your very first post introducing your podcast, the hashtag was more than just a doc.
Yep. You remember that at your age. That is amazing. Holy shit.
Ooh, that's why I can't stand you. Oh,
damn.
Answer the damn question, Nee.
All right, so this is a really good question. So just so y'all know, as a trauma surgeon, for the past 10 years, I have worked in a shift-based model. From the beginning, as working as an attending, I have worked, whether it was I would do a 24-hour shift, and then I would have 24 hours off, and then the next day after that. So let's say Monday, I'm 24 hours in the hospital. Tuesday, I'd be 24 hours off. And then Wednesday, I'd be back, do the same thing, 24 hours in. Then Thursday, I'd be off. And then
But you'd be on backup when you're off.
When I'm off, I'm not completely off. I'm just available. I was like 15 minutes away.
Yeah.
And I would alternate that schedule with another person. And us two would do that for 2 weeks.
Mm-hmm.
And then the rest of the month, I would have 2 weeks off. Now, you probably won't see programs like that anymore because 24 hours to make decisions and 24 hours on straight is really tough in surgery. I don't think you're going to see that much anymore.
You don't think so?
Not the majority of programs. The
Really?
majority of program, if you're going to see 24 hours, it's going to be with residents. But it's very rare that you're going to see 24 hours as a standalone attending by yourself. It's too much, unless it's the weekends, and that doesn't happen that often, right?
Right.
Like if they make you do weekend call and you do 24 hours, you're probably going to do a weekend every 6 weeks or so, right? Mm-hmm. And if you're listening to this and you're doing more than that, I suggest you find someplace else because that is this. I think that is a very tough place to be at. I think, right? So eventually, we shifted the hospital that I was at. We shifted to something where, you do 12-hour shifts, right? So Monday through Friday or even Saturday, you are working, 7 a.m. to 7 p.m. or you're working 7 p.m. to 7 a.m. And then during the daytime or during the nighttime when you're off, you may be back up or you are just sleeping. It doesn't matter. I like that better, right? So I'll work for 7 days in a row and then I'm off. And when I'm off, I'm off. There's no committee meetings. There's no, outside of M&M, which occurs once a month, there's no hospital committee duties that I have. And when I'm home, I'm allowed to be, I'm able to be husband to my beautiful wife. I'm able to be, everything to my kids, everything to the rest of my family. And I'm super proud of that. And I've been doing that for 10 years. I've been ringing the bell about that for 10 years. I've been telling my attendings who taught me about that. A lot of them criticize me for that. They're saying, well, you don't have the patient continuity. You don't have, don't you feel like you're giving up some of your skills? And I'll tell you right now, the majority of those folks who are saying that at that time have come and called me and said, hey, doc, can you teach me more about locums? Can you teach me more about how you work, how you figure it out? Because, I don't have any time off or, I don't have time off with my spouse or my kids hate my guts or whatever it may be, right? It looks in various different forms, but there is absolutely shift work in general surgery. There is absolutely shift work in trauma critical care, and it's amazing. One of the things that I saw from you that I wanted to focus in on real quick because it's low hanging fruit is
I still enjoy EM somewhat, but I realize the chaos makes it very hard for me to feel like I'm focused on one patient at a time. Surgery is one of the few specialties where you can spend hours on one patient.
Do you want to get into that or you want me to start?
I'm not a surgeon. I don't do this.
Well, I'll tell you right now, I did ER. I didn't like ER for that is the specific reason that I didn't like ER is the
your rotation, you mean, or
the pure chaos of it. The pure chaos. It doesn't mean that as soon as you walk into an ER that like everybody is like everything there's just mayhem all over. I don't like handling 5 or 10 patients
at the same time
and having to keep up with them at the same time, and I just don't like that. Is it busy on surgery? Yes. But it's a bit more calm compared to the chaos that's in ER. I'm not saying that it's I'm not poo-pooing it. I'm just saying that it's not for me. So I definitely understand what you're saying about the chaos. And you got to realize, at this point, MS3, the fact that you're able to say that and recognize that, I give you mad props for that because a lot of folks at that time can't really verbalize that this is the reason why I'm not really feeling ER is that I just feel like everything is happening all at once. The other thing I don't like about ER is I feel it to be very restricting.
What do you mean?
Like you're stuck in this ER.
Oh, you don't go anywhere else in the hospital.
Shift, right? And there's no place to hide.
Right.
There's no place to hide. Everybody knows where you are.
Right.
I'll be honest.
At all times.
I'm an introvert, so I like to have like my me time. There's times where I just need to think and get away. I like to eat on my own, or if I eat with, my team, it's a very intimate type of experience where it's just like 3 or 4 of us. Right. But while I'm eating, nobody has the possibility to ask me questions from another department or anything like that. Or, one of the nurses can't reach me and ask me. Like I just like that aspect. And that's another part of ER that doesn't work for me. So I think that you bring up some really, really good points. And I'm going to tell you something right now. Like, this is a bit of advice is try to use your 80-year-old self to make your decisions, right? You may have heard this as, I don't know what they call it, like the graveyard
Or begin with the end in mind.
Yeah, begin with the end in mind. Like,
That's
you always say things better than me.
Covey.
There's that. There's the, I don't know, the nursing home metaphor, whatever it may be. When you old as hell, or when it's on your gravestone, what do you want people to say? What's the story that you want people to say about you? And what I mean by that is, when you're 80, are you going to be regretful that you didn't go for what you really, really wanted to do? Which it sounds to me, it sounds like you want to be a dope doc, and you also want to be an amazing
A
musician.
hip hop artist.
Yeah. Do you want to be the Drake, of
Or
hybrid?
do you want to be Kendrick?
Or right. Do you want to be a purist like Kendrick, or do you want to be a hybrid, right? I'm going for Kendrick.
You going for Kendrick.
But with that being said, I think the key things are this, being a doctor is no joke. It takes a lot of dedication, a lot of sacrifice. You're going to be saying no to a lot of things. You're going to feel like you're on an island a lot of times. But listen, like, this is you, like, literally going for a home run.
Mm.
So I would say is, like, listen, like, shoot for the stars. If you really love surgery more so than ER, like, now is not the time to compromise.
Right.
Right? Because you really don't want to compromise with your career, because you want to talk about regret. Having that notion of, like, that wanderlust or that specialty lust, it sticks with you, right? And it's one of those hard things to shake off. Other thing too is, when you're burnt out, you could say, okay, I'm burnt out from what I'm doing, and maybe if I decrease the amount of time, I still love what I'm doing. But you don't want to get to a point where you burnt out and you really hate your career because you compromised and went in a direction that you didn't really want to go into, right? Because what if music doesn't work? Then all you're left to really is your specialty to give you the satisfaction.
See, I would say this, though. I wouldn't even think about what if music doesn't work. Music will always work, right? However a scale you decide to do it on, right? We're not necessarily talking about, are you going to win a Grammy? Are you going to whatever? It will always work. If you are a musician, you are a musician. So you will always be one, no matter what. But, you just have to think about what it is that you absolutely love to do. And when you love to do something, you will make time for that thing, no matter what it is. So if you love surgery, you're going to figure out how to bring music into your doing surgery, right? Whether you mesh them together, or, you do them separately and then you find time separately to do each of them. But once you love what you're doing, you're going to find the time to do it. So, one of the things that I want, MS3 to understand, and anybody else out there who's thinking about pursuing medicine, is that you don't necessarily have to choose one over the other, right? Like, sometimes people think, oh, well, should I have a life or should I have a career? And it's like, why can't you have both? Why can't you have the life?
I think it happens a lot more with women.
Of course.
Right, with childbearing.
With childbearing and things like that. What you should be looking at is not how your career is going to necessarily affect your life, not how your life is going to affect your career, but how your career is going to be incorporated into your life. That's what you should really be looking at. So you should have life, music inside there, surgery inside there, being a family member inside there, and whatever else you identify as something that is important to you. But it shouldn't be career and then let me figure out how to make my life work, around this career. So
I'll leave it to you like this. You can ask Renee. She'll tell you, like, I don't have many regrets with my the path towards medicine, becoming a surgeon. There's not many regrets that I have. The one regret that she knows that I have is, I want to read something that you wrote. It says, and if I choose surgery, I'll lose the other parts of me that make me who I am. And you put in there about music. I'm terrified that I'm either about to make the worst or the best decision of my life. So the regrets that I have center in how I responded to stress, how I responded to people who are either stressful, malignant in their nature, and letting basically some of that ooze and that filth come on me, and then allow me to actually act like some of my captors, so to speak, right? So because, my residency was a sink or swim type residency, at least that's what I perceived it to be. Yeah, I developed a certain type of armor. I developed a certain type of mentality of I'm not going to be killed. I will kill someone, but I'm not
Kill
going
or
to
be
kill.
killed.
And this is metaphorically, everyone. We're in jest.
Yeah,
Right?
hopefully you ain't kill nobody as a surgeon.
Right. So there were certain characteristics that I took on that I think Renee had to call me out on. Right. Remember, I was doing a schedule once, and I was just taking a very vindictive approach to certain requests that were made for the schedule. And after a while, it's just like, look, someone literally just wants or is just requesting, a golden weekend, a weekend where they can have Saturday and Sunday off. But because I didn't have that, or because when I asked for that, someone came at me really nasty,
Sideways.
more than sideways, then I'm deciding to take that out on somebody else, right? So when I say, and if I choose surgery, I'll lose other parts of me, there was a part in residency that I look back on and I regret I lost a little bit of me because in order to survive, I felt like that's what I needed to do. And I started to see a bit of that even in the beginning of my term as an attending. I wasn't changing, but I saw the results of people being assholes, people being really difficult to deal with, people, taking literally some of the personalities that they could get away with in the hospital and doing it at home.
Mm-hmm.
Let's just say some of them went through divorces and so forth, right? And this is not calling anybody out, but it's just saying that, listen, like all of this stuff has a what's the word? An expiration date.
Right.
It's going to be an expiration date on your relationship or an expiration on people wanting to spend time with you. So if you are letting a specialty change you, that's on you. And I look back and I'm like, I should not have allowed my situation to change my personality or to change how I speak to my family or even to speak to my girlfriend at the time. Like, that's on me. Like, there's a point where you have to be like, listen, this is some nasty behavior. This is some really like, what's the word I want to use? What's the word? It starts with an M. This is some malignant behavior, and that the buck stops with me.
Yep.
I'm not gonna be the person who's gonna continue that. So what I'm trying to say is, listen, whether you choose surgery or if you choose EM, choose it because you can see yourself doing it in 10 years. You can see yourself doing it in 15 years and be extremely, have extreme fun with it. But I can tell you right now, whether you choose surgery or you choose EM and you decide to go into music, there's going to be people who are going to give you a hard time about it. You can go into internal medicine. Someone's going to give you a hard time about it. You can go into preventative medicine. There's going to be less people saying about it, but you can go into preventative medicine. And people are going to be like, listen, anonymous med student 856, are you serious about preventative medicine?
Yeah.
Are you serious about pathology?
Yeah.
Right? So it's just like, listen, I just, the way how I look at it is, you got to remain who you are. Now, obviously, you got to be appropriate for the situation, but also at the same time, you can't let people change you. And that's the flex that I wish someone had taught me before, I started to realize certain bad behaviors, and you realized it in me.
I think, I hear when you say, that was on you. And ultimately, right, your behavior is always going to be
Look at
on you.
She's trying to change it now. That's what you said to me.
I'm
you
not
try to change
changing
it. Don't try to go back. And
I think that there are now more forums, kind of like what you were saying before, right? There are more forums now to be able to be very, very vulnerable and be able to express things like this so that, those who are still up and coming can recognize that there's something that you can do about it and that this is not normal, right? This is not normal to lose yourself. I don't think that we talk about that enough, about people being afraid of losing themselves or realizing that they actually have lost themselves. And I think it can lead people down very, very, very dark paths. And so I commend, MS3 for writing in about this. I'd say to everyone who's out there, who's up and coming, going, into medical school, into residency, and even as attendings, if you are realizing, if you sit in the quiet, right? If you sit in the quiet, you will know if you have lost who you are. And if you have, ask someone who you really, really trust Ask someone who you really, really trust to be very candid and ask the question, do you think I'm different than I used to be and not in a good way? Do you think I'm different and not in a good way than I used to be? Ask that question, because the people who you trust the most, the people who love you the most, they will tell you the truth, and if you listen to them, you just might find that, you can fix some things about your life to make you happier than what you are right now.
But I can tell you right now, surgery's dope, though.
It's all right.
Surgery is
It ain't
dope,
OB.
yo. Let me tell you something right now. Hey!
It ain't OB.
Surgery, you
The
do
giver
everything.
of life.
Some people have to say things to make themselves feel better, but I'm gonna tell you right
You're a
now.
trauma surgeon, so
Listen, and it's
we
amazing.
know we know how all of your cases end up.
That's fine. Like, we love fixing people's mistakes. It's all good.
Okay.
We love it.
Why y'all always got the Grim Reaper standing right in the trauma bay? Talking about,
Yeah, it is. So
I'm just waiting.
I'll tell you this right now: surgery, or at least trauma surgery, at least it's you pulling people from the gates of where the gates and stuff.
You really are.
You win some, you lose some. But I think definitely,
Dim some, you lose some.
I think definitely the the team approach with trauma surgery is unlike anything else. It's funny, like ER is the same way. Like, you rely on your nurses, you rely on a big team to kind of get you through the process of taking care of people. But with trauma surgery, definitely it's a team approach, right? Not only is other specialties helping you, but you have nurses, you have case managers, you have social managers to help you through the problems that you can't account for, that you don't even have the training for, right? Like, how do you get someone out of the hospital once you've taken care of all their ribs
and nursing home or into
right? That's the toughest part. Yeah, those are really tough things. But I could tell you this right now, you remember once I did my surgery rotation, I knew this is what I wanted to do. Even though when I first came into med school, I was like, I want to go into OB, or I'm going to try to give everything a chance. And, I did orthopedic surgery only because I thought maybe I wanted to do orthopedic surgery. When I did that, I was
because you thought you wanted to work at Home Depot.
Yeah. I just did not like orthopedic surgery. I did not like, guys, listen. It's amazing how you can do surgery and say you really love surgery, but when you see different parts of surgery, you're like, yeah, this is not for me.
When I look in the ortho room, I'm like, oh,
hell no. I could not do orthopedic surgery. And no shade to all the orthopedic surgeons who are listening.
It is not for the faint of heart.
And real quick, once again, I got to say this again. How many people listen to this show and they be getting upset about the things that we say?
Who gets up?
No, seriously. People who
listen.
Everybody who listens to this show, y'all need to stop taking things so seriously about what we say. And I think we need to have a disclaimer on this. Stop taking things so personal, yo. Damn.
What's the matter?
I almost got hemmed up in the hospital once because
by orthopedic surgeon.
No, not by
drilled you.
Not,
almost hammered your ass.
Not by an orthopedic surgeon, but people are like, oh, why are you talking about me? And I was like, I'm not talking about you. Damn.
Even though you're really talking about them.
I was, but. It's just chill. Chill. This is said in jest, in truth. Come on.
Truth is said in jest.
Yeah. But anyway, listen, anonymous medical student, these are great questions. To me, it sounds like you want to go into surgery. So I'm just going to keep it real with you. Go into surgery, or at least, your MS3, make sure you do a general.
Yeah, do the rotation.
Do a very traditional general surgery rotation.
Yeah.
Don't, I would start off by doing a very traditional general surgery residency where there's a hierarchy, right? You're working with residents, you get to see how they work with attendings and all these different things. So you see the most traditional, basic form of surgery. And then if you want to do more, see if you can do a one-on-one experience.
Yeah. That's what I was going to say. I mean, isn't the experience in surgery in the hospital very different than let's say a private practice general surgery?
So it depends, right? So for example, if you just want to see the surgeries, right?
Yeah,
if you just want to see the surgeries, then yeah, you possibly could just get by with shadowing a private practice surgeon, right?
Yeah. But I think at that point, don't you?
But there are people who are like, yo, I love, for example, I like GI, right? But I don't like GI that much that I want to go through internal medicine for 3 years and then go through another 3 years of fellowship. Hell no. Just to do scopes? I don't want to do that, right? So that's what I'm saying. Yeah, you could go to surgery and love appendectomies and love doing gallbladders, but then you go through and you're like, wait, I got to go through all this with residency? I don't want to do this. That's what I'm saying. It's good to see what your life is going to be in the next 2 years. and also see what it's going to be like in the next 5 to 7 years. That's how I look at it.
But I feel, so I'm going to say this. So I'm not a surgeon, obviously. I'm not a general surgeon.
I thought OBs are surgeons.
Well, I'm not a general surgeon. But I will say this. So my experience was obviously in terms of residency, mostly in the hospital, like most residents, right?
Right.
You have a clinic month that you do, but even in that clinic month, you know, you might have surgeries to go to and things like that. Or excuse me, I have clinic days, not clinic month. You have a clinic day. Anyway, whatever. Anyway, so, but when I was done and I was doing full scope OB, my day did not look anything like it looked when I was in residency, right? The day changed completely. The day changed into going into clinic, spending most of my time, probably about 85% of my time in clinic, so that I could see outpatient, you know, I could see outpatient, the OB patients, GYNs, right? And then drum up patients for surgery who needed surgery. And then that the rest of that 15% was spent mostly in the OR, maybe every now and then occasionally in the ER and doing consults, but mostly in the OR. So most of my day was spent actually doing office work. So that, I guess that's my question.
So what advice would you give to someone who's going into 4th year and they need to decide a specialty? They're looking for rotations to do, right? Like, for example, how about this, right? Let's say someone says, yeah, I want to be, you know, I want to go into REI, right? So I want to help people with infertility, right?
Right.
And how you do REI in an academic system, it's a lot different than how you do REI.
REI is probably not a good. REI is probably not a good.
Okay, let's keep it for OB then, right?
But let's just keep it for OB.
How do you do that? You know, at an academic center versus how you do that in a community-based system. Like, what kind of advice would you give? Because for me, I think it'd be difficult, right? Like, trauma surgery is practiced the same way.
Yes, trauma surgery specifically
at an academic center. But there are people who really enjoy they enjoy like the end product, but they don't want to go through the stuff.
Right.
And if you don't let them get the experience of going through stuff in some form or fashion, isn't there a possibility that there could be a big ass letdown?
It could, but that's what I'm saying. Like, so is MS3 wanting to go into trauma surgery specifically or general surgery? Because general surgery and trauma surgery, they not the same thing. And they are very different in terms of the settings, right? If you go into general surgery, you're probably going to have the experience that I just described, which is you spend a lot of time in your office because you got to drum up patients. Otherwise, who are you taking to surgery? There's nobody going to surgery. You got to drum up patients in order to go to surgery, right? And see the post-ops and pre-ops and all these people, right? Whereas in trauma surgery, you just sitting there waiting, just be like, all right, waiting for the next tragedy to happen, you know, so that I can get patients. You're literally just waiting for someone to bang themselves up. So, you know, it's just a very different setting.
I would say this, anonymous med student, make sure you give yourself the experience, get the experience that you need. I would say if you can do a traditional practice or a traditional rotation, do the traditional rotation. If you have an opportunity in your 4th year to do something a bit more focused, like try to get like a generalist experience in whatever you want to go into. So if you want to do general surgery, then see what it's like after residency also. That's super important also. Yeah. Same thing with what you said with OB, because I didn't think about that, right? Like you do OB
right. Well, because in a hospital. You've never done office though.
Right. Well, we do office, but it's not like
no, I mean as office. An attending.
I do office as an attending, but it's not like anything like you
right,
guys.
But it's like hospital based. Yeah,
we rarely drum up business in an office setting. It's very much what comes through the emergency department.
Yeah, you know, I'm talking about the traditional private practice model or hospital practice model.
But yeah, this is anonymous medical student. Anonymous med student 856. Thank you for writing in. This is a dope question. This is a life question. And listen, man, I'm telling you, there's no perfect answer to this, but this is as real as you can get. Like the question that they wrote, as real as you can get. We gave you an answer as real as we can get. And anybody else who wants to, I think this person went through our website actually.
Yeah, I think
Yeah.
so. Yeah.
So that's another way
Yep.
that you guys can reach out to us is by going to our website and looking to see.
DocsOutsideTheBox.com.
That is true. That is true. Listen, y'all, we're going to have to jet on out of this. We appreciate everybody who writes in, and this is what we enjoy doing. We enjoy, expressing and sharing, the things that we've gone through to give you guys advice, because everything we say is correct.
You just said that. Before you said everything that you said is not necessarily correct. Now everything that you said
I
is
said that in
correct.
terms of talking about people, like, what we say
No.
is just.
Well, before that, you were like, though everything that we say can't be correct, but I'm going to keep moving forward. You thought I forgot.
Yeah, it was minor stuff, right? Like
Okay.
very minor stuff with S Corp, but the majority of everything we say is correct.
Well, the algorithm shows that you guys do not listen all the way until the end. So this conversation is over.
Peace, y'all.
Bye.
You say something, Renee. Pretty please.
Hey, Alfred.
Hey, Alfred.
Are you scared, Alfred?